With the rising concerns about health in general, and with the addition of a seemingly endless train of medical challenges, diseases, and viral infections, including COVID-19, Americans are more concerned about monitoring their health and taking steps to help protect wellness and avoid sickness and health issues now and in the future. To that, we say, well done. Hi, I'm Jake Baker, co-founder of OXL MedStar. Our new generation health monitoring and pre-crisis alert system could well save millions of lives and dramatically increase your life expectancy. This new medical health care product is unlike any other on the market anywhere in the world. OXL MedStar can anonymously track an individual's vital health signs wherever they are 24 hours a day, 7 days a week. This cutting-edge technology anonymously monitors vital signs that may give a crucial advance warning of a personal medical crisis before it occurs, and in most cases, before a crisis has even begun. OXL MedStar is able to notify the client, their caregivers and doctor, medical team, and even an emergency response team if necessary to help avert the crisis or at the very least treat the symptoms and minimize the impact from potentially devastating problems. The recent COVID-19 pandemic has clearly exposed how unprotected we all are and how ill-equipped we are to detect a medical crisis that may have dire consequences. Worse yet, if one is over 40, they typically have 3 conditions being treated pharmaceutically with no way of knowing if the drugs are having the desired effect when the individual is at home, on the road, at work, or even in their favorite restaurant. Obviously, the new wearable fitness trackers and phones are better than just a thermometer one cannot often find and an oximeter with a dead battery. Developing one's own self-diagnostic skills based on fitness information like steps, restful sleep, and calories is a good first step, but unfortunately, even the best self-diagnosis may not detect an oncoming heart problem, stroke, or other potential health emergencies. At OXL MedStar, we appreciate the steps so many have taken to monitor their health. In fact, that's why we knew it was vital for us to bring this technological advancement to America. The choice is simple: self-diagnosis or health monitoring with the world's most powerful analytics recorded every 15 seconds. You heard that right, every 15 seconds. The traditional in-hospital healthcare model of today clearly demonstrates the new mobile model of OXL MedStar's remarkable monitoring approach. An ICU or intensive care unit is always equipped with full-time digital healthcare monitoring of all of your vitals. The real-time monitoring gives doctors peace of mind through digital processes that will spot problems and alert the staff if something is going wrong. The problem is that the patient cannot even gain admittance to the ICU unless a caregiver decides they need to be connected to digital monitors to look for advanced symptoms of the next crisis. But OXL MedStar is not about crisis management. It's about pre-crisis monitoring, intervention, and alerting. Then, if and when one recovers in the ICU and the digital vitals indicate recovery, the caregivers move the patient from the ICU to a regular CCU, clinical care unit hospital room, where they digitally monitor, albeit less intensively, the patient's vitals and physically check the patient until the judgment is made to send the patient home. But upon release from the medical institution, digital medical monitoring of vitals stops, even if the patient leaves with a bundle of pharmaceuticals and a home treatment plan. The patient might be given a call-in number for a virtual office visit or video conference telehealth session, and a number for a call center to discuss treatment plans with a telemedicine nurse. At OXL MedStar, we believe there's a better way, and we're reinventing the healthcare monitoring process. Instead of stopping digital monitoring when the patient leaves the medical institution, we provide the patient with a wearable, mobile ICU-CCU equivalent with the same analytics, alarms, and notifications. But there's no need to wait for a medical emergency. Our fashionable, wearable monitoring devices such as the OXL MedStar watch, ring, or amulet anonymously emulate the digital care unit wherever you are 24 hours a day, 7 days a week, every day of the year. But best of all, you don't have to wait for a crisis or visit an ICU. Our pre-crisis monitoring is the perfect HIPAA-compliant solution to alert you before a crisis. That peace of mind alone can add years to your life. During the latest COVID-19 pandemic, it became obvious that senior living centers, nursing homes, jails, meatpacking plants, factories, stores, hotels, motels, entertainment centers, and private homes had no healthcare monitoring process for checking vitals. Even the health caregivers in the hospital were not being monitored until they were assigned a hospital bed and room. OXL MedStar is here to prevent that disaster from ever happening again to you and to your loved ones. We provide the medical monitoring devices that digitize your vitals with fashionable wearables. And depending upon your situation, we can also employ whatever is necessary, including cameras, smoke detectors, nightstand units, motion sensors, microphones, and other smart devices to monitor you and your physical environment and report our analysis to you and to your caregivers that protect you. Our pill monitor and dispenser, for example, make sure that you or a loved one always take your pills on time and never take them twice by accident, while our wearables ensure that they're having the desired impact on your vitals. Our self-disinfecting and self-cleaning toilets automatically disinfect the seat after every use, and they can weigh you and even monitor usage and collect key biological information associated with your vitals. The OXL MedStar process uses an AI-driven mainframe platform to collect the real-time patient-generated health and environment protection data. The digital data then flows to the largest, smartest AI health analysis platform in the world, IBM's Watson. This data and analysis are made available to you, your healthcare team, and your doctor within 30 seconds of detecting abnormal signs. We protect your privacy because the data is only available to you and your doctors and is a vital health asset whenever they do a personal review or diagnostic session with you. The real-time monitoring and AI, machine learning, and first-of-its-kind processes are designed like the ICU-CCU to detect early warning signs and help you and caregivers take actions before a physical crisis begins. For example, OXL MedStar's cutting-edge technology can give advance warnings of an oncoming heart attack several minutes before it occurs. Knowing the signs before the crisis can give you time to take the necessary steps to stop or delay the attack and give you precious time needed to seek immediate medical help. And whether it's an oncoming heart attack or fall prevention because of advanced blood pressure warnings and other vital sign analysis, OXL MedStar is there 24/7 to protect your health and wellness. The real-time ICU-CCU-like medical monitoring also helps your doctor better manage chronic disease and treatments in the home via fashionable wearable sensors. Also, BLE medical devices, blood pressure sensors, pulse oximeters, chest monitors, also with scales, automated drug dispensers, activity monitors, spirometers, and other smart devices. Adding the data analytics and vital records will also forever change the current telemedicine and telehealth shortfalls that have heretofore only started after the health crisis is underway. Because of our great medical system and our health care and medical monitoring processes, we're living longer, but with longer lives comes some medical challenges. Today, 1 in 5 people have 3 conditions being treated pharmaceutically with no real-time monitoring for results. AARP, for example, has 40 million non-monitored members who may be just minutes away from a 9/11 crisis. Unfortunately, for far too many, their medical alert system is a button to push in the midst of a crisis. At OXL MedStar, we don't believe that's an acceptable solution. It should also be noted there are over 68 million 65 and 65 plus Americans in that untenable situation, with 85 million more that are under 65 and being pharmaceutically treated for non-monitored health conditions. We also have 2.5 million military employees ready to go to battle with no healthcare monitoring system or no 911 button. The best they have is someone calling out medic in a time of crisis. Here are a few of the key features of OXL MedStar's health monitoring system: heartbeat monitor, GPS accelerometer, water immersion detection, late departure warning, Wi-Fi, mesh, and Bluetooth connectivity, antimicrobial, hermetically sealed, hypoallergenic, adjustable custom band, GSM cellular priority ping, water and dust proof, shatterproof face, shock resistant, rechargeable battery, motion rechargeable battery, solar rechargeable battery, dual sensor technology, fall detection and alert, heart arrhythmia alert, blood pressure alert, skin temperature alert, perimeter and tamper alerts, 360 camera, listen and incident recording, Bluetooth and Wi-Fi event interface, Android, iOS tracking, blood glucose monitor, fail-safe mesh network wireless router, and predator location. The OXL MedStar devices measure heart rate, blood pressure, glucose levels, and can indicate stress, water immersion location, respiratory problems, AFib, snoring, sleep apnea, blood pressure, falling down, and more, making it the most complete, wearable, personal coverage ever, and it's monitored 24 hours a day, 7 days a week. Obviously, what makes us different is real-time monitoring. OXL MedStar wearables deliver real-time updates every 15 seconds, so caregivers and caretakers as well as medical professionals are notified the instant your vitals change adversely. OXL MedStar devices are built to last and always on. From kids to those of us who aren't kids anymore, we tend to be a little hard on some of our possessions, particularly wearable technology. That's why OXL MedStar's wearable devices are virtually unbreakable, tamper-resistant, waterproof, impact-resistant, and long-lasting. And they're always on. OXL MedStar devices works with cellular, Wi-Fi, POTS, Bluetooth, and mesh networks, so there is no risk of downtime wherever your loved one may be. And we are the perfect integrated solution. Our solution is comprised of intelligent devices, AI software, and machine learning programming, as well as massive amounts of computer power. The devices can communicate with each other and third-party fitness devices like Apple Watch, Samsung Galaxy Watch, and Fitbit. Our ring, watch, pendant with undetectable touch probes, base stations, tablets, smartphone apps, proximity sensors, pill vaults, Band-aids, cameras, toilet fixtures, and wireless access points ensure peace of mind knowing that if there's a problem, we've got you covered. And of course, we're professionally monitored. The OXL MedStar devices come complete with our custom Realize AI software that passes the telemetry to IBM Watson to analyze and predict outcomes for each person. We can anonymously pass this analytical data and our own information to your physicians, caregivers, local information providers, and all professional monitoring centers like ADT, Vivint, Stanley, Alarm Force, and more. Our team consists of some of the best and brightest minds in the world, with lead scientist Howard Gunn, world-renowned for his paradigm-shifting work in electronics, switching, and AI. The team includes several world-class leaders in business, science, engineering, communications, networking, medicine, and philanthropy that are all committed to one thing: giving you peace of mind. OXL MedStar stands alone on the cutting edge of medical health monitoring and pre-crisis alert systems. No one else in the world comes close, and virtually no one else has even tried to figure out how to build a virtual mobile ICU around you and your loved ones. The market is virtually untapped. AARP today, for example, has 66% penetration into the older American market in the United States. A mere 10% penetration into the seniors market would be worth $1 billion per year in revenues and help save lives through a doctor's review of your AI assessments. When one considers that Japan, Great Britain, and the EU have even higher percentages of aging citizens than the U.S., it's not hard to imagine the size of the market both here and around the world. Additionally, with the Asian market and emerging markets on continents across the world, the opportunities and waiting markets are endless. We know that OXL MedStar has a brilliant future just waiting to be realized. We'd like you to be a part of this exciting venture. For more information, please contact our business development team.